a journalist's account of the 2025 measles outbreak. The return of a forgotten threat. It was a cold morning in January 2025 when I first heard the unsettling news. Measles, a disease we had long considered eradicated, was making a comeback in the United States. The initial reports came from Houston, Texas, where two unvaccinated children had contracted the virus. At first, it seemed like an isolated incident. But as days turned into weeks, the situation escalated. By mid-April, the Centers for Disease Control and Prevention (CDC) confirmed 800 cases across 25 states, with Texas bearing the brunt of the outbreak. The epicenter was Gaines County, a rural area with a significant Mennonite population, where vaccine hesitancy was prevalent. The virus spread rapidly, jumping state lines into New Mexico, Oklahoma, and Kansas. The outbreak had become one of the worst the country had seen in decades. A devastating toll, the human cost was staggering. 3 deaths were confirmed, all among unvaccinated individuals, 2 children in Texas and an adult in New Mexico. Hospitals were overwhelmed, with 85 of the 800 reported cases requiring hospitalization. The majority of those affected were children and teenagers, many of whom had never received the measles, mumps, and rubella MMR vaccine. The virus's resurgence was a stark reminder of its potency. Measles is highly contagious and can lead to severe complications, including pneumonia, brain swelling, and long-term immune suppression. In rare cases, it can cause subacute sclerosing panencephalitis (SSPE), a fatal neurological disorder that can develop years after infection. The role of misinformation. As I delved deeper into the outbreak, I discovered a troubling trend. Misinformation about vaccines was rampant. A recent poll revealed that approximately 60% of American adults had encountered the false claim that the MMR vaccine is linked to autism. Among parents who believed this misinformation, 24% reported delaying or skipping vaccinations for their children. This widespread confusion was exacerbated by public figures who questioned the safety and efficacy of vaccines. Health and Human Services Secretary Robert F. Kennedy Jr., known for his anti-vaccine stance, visited the epicenter of the outbreak in Texas. His presence sent a conflicting message to the public, undermining efforts to combat the spread of the disease. The fight for public trust. In the face of mounting challenges, healthcare professionals stepped up to combat the outbreak. Dr. Helen Jong, a pediatrician in Houston, made the difficult decision to administer the MMR vaccine to infants as young as 6 months, despite the CDC's recommendation of 12 months. Her own 5-month-old daughter received the vaccine early, a testament to her commitment to protecting her patients. Public health campaigns were launched to educate communities about the importance of vaccination. Clinics extended hours and mobile vaccination units were deployed to reach underserved areas. Despite these efforts, vaccine uptake remains sluggish, hindered by lingering distrust and misinformation. A global perspective, the outbreak was not confined to the United States. Cases linked to the Texas outbreak were reported in Mexico, underscoring the global nature of infectious diseases. The World Health Organization issued a disease outbreak news alert, highlighting the resurgence of measles in multiple countries and the challenges posed by declining vaccination rates. The international response was swift, with health organizations coordinating efforts to contain the spread. However, the situation served as a stark reminder that infectious diseases do not recognize borders, and global cooperation is essential in combating public health threats. Lessons learned. As the outbreak continued to unfold, I reflected on the lessons learned. The resurgence of measles was not just a public health crisis, it was a crisis of trust. Misinformation had eroded confidence in vaccines, and complacency had allowed a preventable disease to regain a foothold. The experience underscored the importance of clear, consistent communication from trusted health authorities. It highlighted the need for ongoing education and outreach to combat misinformation and build public trust in vaccines. The 2025 measles outbreak was a wake-up call. It reminded us that the fight against infectious diseases is ongoing and that vigilance is required to maintain the progress we've made. As I continue to report on public health issues, I carry with me the stories of those affected by the outbreak, the children who fell ill, the families who lost loved ones, and the healthcare professionals who worked tirelessly to contain the spread. This experience reinforced my commitment to seeking the truth and sharing it with the public. In a world where misinformation can spread as rapidly as disease, journalism plays a crucial role in informing and protecting communities.